Imaging of chemokine receptor CXCR4 expression in culprit and nonculprit coronary atherosclerotic plaque using motion-corrected, 68Ga pentixafor PET/CT. Via European Journal of Nuclear Medicine and Molecular Imaging. Abstract. Purpose. The chemokine receptor CXCR4 is a promising target for molecular imaging of CXCR4 plus cell types, for example inflammatory cells, in cardiovascular diseases. We speculated that a specific CXCR4 ligand, 68Ga pentixafor, along with novel techniques for motion correction, would facilitate the in vivo characterization of CXCR4 expression in small culprit and non-culprit coronary atherosclerotic lesions after acute myocardial infarction by motion-corrected targeted PET/CT. Methods. CXCR4 expression was analyzed ex vivo in separately obtained arterial wall specimens. 68Ga pentixafor PET/CT was performed in 37 patients after stent-based reperfusion for a first acute ST-segment elevation myocardial infarction. List mode PET data were reconstructed to 5 different datasets using cardiac and/or respiratory gating. Guided by CT for localization, the PET signals of culprit and various groups of non-culprit coronary lesions were analyzed and compared. Results. Ex vivo, CXCR4 was upregulated in atherosclerotic lesions, and mainly colocalized with CD68 plus inflammatory cells. In vivo, elevated CXCR4 expression was detected in culprit and non-culprit lesions, and the strongest CXCR4 PET signal, median SUVmax 1.96, interquartile range, IQR, 1.55 to 2.31, was observed in culprit coronary artery lesions. Stented non-culprit lesions, median SUVmax 1.45, IQR 1.23 to 1.88, P equals 0.048, and hotspots in naive remote coronary segments, median SUVmax 1.34, IQR 1.23 to 1.74, P equals 0.0005, showed significantly lower levels of CXCR4 expression. Dual cardiac, respiratory gating provided the strongest CXCR4 PET signal and the highest lesion detectability. Conclusion. We demonstrated the basic feasibility of motion-corrected targeted PET/CT imaging of CXCR4 expression in coronary artery lesions, which was triggered by vessel wall inflammation but also by stent-induced injury. This novel methodology may serve as a platform for future diagnostic and therapeutic clinical studies targeting the biology of coronary atherosclerotic plaque. Add tags, currently, imaging. Medicine by Alexandros G. Sfakianakis.